Hello, everyone. I'm excited to be here today with both a manufacturing executive and public health expert to talk about workplace vaccine policy. It is a time where we're seeing employers in different industries and sectors adopt similar policies, and would like to begin by commending you as leaders for your willingness to share your experience with us on this sensitive issue of workplace vaccination policies. Beginning with a warm welcome to both of our panelists. Joining us from Ontario, Steve Chaplin, Vice President of Health, Safety and Environment at EllisDon, a world-leading construction and building services company that completes more than $5 billion worth of contracts annually in every market sector and around the world. And many of you will also recognize our second panelist from Vancouver Coastal Health, Medical Health Officer, Dr. Michael Schwandt. He's been a key partner in our efforts to keep our members here in BC informed and educated throughout the pandemic. Thank you both for taking the time to be here today. Starting with yourself, Stephen, could you briefly introduce yourself and your role at EllisDon, particularly your journey through the pandemic response? Welcome.
Welcome, everybody. And thank you, Lisa. Like Lisa mentioned, my name's Steve Chaplin. I actually lived in BC for most of my life and made the journey over here to Ontario about 4 years ago. So I'm fortunate to lead about 165 health and safety folks across all of EllisDon business groups. So we operate in healthcare as well. We operate many hospitals within the facilities and many of the large infrastructure projects, including some manufacturing as well. I guess, speaking specifically about the pandemic, we've been very active in trying to be leaders across our business areas and to be leaders in the industry. Personally, I sit on the Health Canada Industry Roundtable on COVID and COVID testing, and we've been partnering with that, so we can tell you a little bit about that. Our team's been very active with creating the protocols around enhanced screening. What does that look like? Creating portals and communications for our employees. We've implemented a health line where our employees can, through email or phone calls, 24 hours, can call and get advice on COVID, or what our protocols are to report that they have a case, and then we can provide them some guidance. Right now, we're focusing on return to work. We most of our businesses are open at the sites, but our main office here is still, still pretty slow. I would say we're probably at maybe 20% at our main office here. But that's a bit about me.
Thank you, Steve. And again, once again, thank you for being here. Michael, many of our attendees already know you, but if you could please briefly introduce yourself for those who haven't met you and your role at Vancouver Coastal Health.
Yeah, I'm Michael Schwandt, Medical Health Officer at Vancouver Coastal Health. So I'm a regional lead for health protection. And for those who don't know, as well as including, as you'll gather from the name, we cover the area of Vancouver, but also the city of Richmond to the south, the North Shore, North and West Vancouver, and the Howe Sound and the sea to sky areas, everywhere from Squamish to Whistler and other communities. So we've been working, of course, on COVID-19 prevention and control right through the duration of the pandemic. And in terms of work with this sector, from an early stage that included having to manage clusters, outbreaks, transmission within the sector, and actually worked with some really excellent partners to do so, both the Manufacturing Safety Association of BC, as well as many specific employers and workers as well, to control COVID when it appeared in their workplaces. So we think that we actually developed some very good practices early on in the pandemic, and these were in turn embedded in COVID safety plans that everyone was developing as we continued to work and move through the pandemic throughout 2020 and 2021. And quite happily, our work turned from preventing COVID-19 through those safety plans to adding the tool of vaccination early in this calendar year in 2021. And so we had, again, a very good partnership with the sector, trying to promote vaccination into the population in general, but also to some working contexts that have been at higher risk. And so we're actually able to have earlier access to vaccination through specialized clinics for people working in many different settings, including many in manufacturing, as early as March 2021, ahead of some people's age mates, if you will. And we thought that was very important to manage the risk where we had seen transmission right through the pandemic. And so this has been a tale of transmission, of preventing transmission through many different means. And this is, at this point, this juncture, we have more tools available to us that we'll be discussing a little bit today. So thanks for that introduction.
Thank you, Michael. And I will just want to, follow up with that. You have absolutely, and your team, together with other health authorities, help support our membership in many different ways to get the right information at the right time to help support our transition and processes throughout this pandemic. So moving right into our conversation, Stephen, what was the rationale behind your decision, or the decision at Ellis Don, to implement a vaccine policy? And when and how did you go through that? And when did you make that decision specifically?
Thank you. Listen, it's been quite a journey, and maybe I'll just walk you through some of the journey on why we got to that point. And it's been very difficult for us to implement it, but it really aligned with us as the values of a company and protecting the health and safety of our workers. So, going on that journey, there's been two real main points that we'd want to say is we've been trying to find that mechanism to keep our workers safe and those that they work with and in the communities they work with, but also operational resiliency in terms of, so in essence, keeping people safe and keeping the business operational. Many of our locations that we work at are hospitals, critical infrastructure, and shutting down was not an option. And we did have high numbers of COVID cases. So when you look at COVID cases in terms of the way a lot of the health authorities classified them, what we found was if a worker got COVID, whether it was at home or through friends, family, or other, we would report that as a COVID case, and then that would get reported against us as a company. And so with our Section 22 orders and that were issued largely through Ontario and many of the places we work, if you had two or more cases, work sites were having to be shut down or stronger measures be put in. When we actually really took a look at what measures we put in and what we were doing, we really found that we only had a workplace transmission rate of about 0.25% from worker to worker. The rest was being brought into the workplace. So it led us to people are carpooling. Certain sectors of businesses would socialize more after work, going out to lunch together. And so we really had to put those enhanced measures into, if we see you carpooling and you're not wearing proper PPE and masks and such, then we're not going to allow you onto the premise. So we really started building those enhanced measures. And early in the year, it started off in the Ontario government, they opened up, a pilot project on rapid testing, rapid screening. And so we started off very slow and we looked at voluntary. And we very quickly learned that on sites with 300 people, we'd only have about 15 people voluntarily take a COVID rapid test. So we did something we thought was a little unorthodox. We didn't know if it'd get challenged, which it did, and I can speak to that. But we implemented across our business areas where we had high community spread with COVID, mandatory, when we used the Abbott Pan Bio rapid test, we implemented mandatory testing. We had a few challenges. We had a few walkouts initially, and we had one union challenge with the labor board, which actually was really good because it set precedent across Ontario, and it was upheld on behalf of Ellis Don that yes, employers in a pandemic can put measures in place to provide the health and safety of the workers. So we simply said, you don't have to take a rapid test, but you can't have access to the site unless you do so. And our program has evolved to our peak was around 14,000 tests a week. We would be testing the workers twice a week. And we've now done over 225,000 rapid tests, and that program is still going. So a little bit on that journey. Probably another reason why we started moving towards a mandatory program is as vaccinations started to roll out, we started to see that our clients were starting to ask for a mandatory workforce. Not all of them, but it started off with the hospitals, some of the institutions, universities and such, you would see that. So it looked like we needed to have a mechanism for that. We also saw that COVID wasn't going away. You had to, as a company, do more than just enhance measures. And vaccination seemed the way to further provide protection to the workers and to help overall the country get out of this. So one of the things we also did is we looked at hosting, and it was very successful, an industry-led partnership where we hosted a vaccination clinic. And so we partnered with some of our larger subcontractors. And we actually hosted a clinic that we did 14,000 vaccinations over 10 days that the companies as a whole fully funded outside of healthcare, so that we allowed the community at large to use when vaccines were hard to get, the pharmacies and that. So this is really what we're trying to speak to is the journey about why are we doing it? We're keeping workers safe. We're keeping the business operational. It's aligning with the values of the company of it's the right thing to do. I would say that really led us to where we are now, which is implementing a vaccine mandate. And I think maybe you've got another question on that, and I'll hold on that one, and I'll tell you a little bit about the trials of implementing the program.
Well, what a journey it's been, and recognizing that you're not only operational in Canada must have been, not as easy. The complexities around looking at different places in the world as well at different times of transmission in terms of where that transmission is in terms of just the amount of transmission happening in different parts of the world. So thank you for that. Michael, at the Health Authority, what are you hearing from employers in terms of challenges around the vaccine? And how has it changed from the early days of the priority rollout for food processing and manufacturing to where we are today?
Yeah, we've definitely seen some changes in the nature of vaccine promotion over the last while. It's been almost a year since we delivered the very first vaccine doses here in BC, or anywhere in Canada or the world for that matter, right before Christmas and the other holidays. Last December was when we began. And early on, there was a great deal of enthusiasm for the vaccine. We found that the majority of people in the general public and in specific sectors, certainly including manufacturing, didn't need much more specific prompting other than the very profound experience of living in the pandemic for nearly a whole year at that time. So the availability of a vaccine to protect themselves, to protect their families, to protect their communities, limit transmission overall, and limit these effects of the pandemic that we were living under was enough to get most people out to get that first dose as soon as it was available to them. We had lineups, we had systems, in some, not many, but in some cases, even electronic systems breaking under the load of people rushing to register, which is people spending careers promoting vaccination and promoting public health. This is really a heartening thing to see people coming out with such enthusiasm. Now, there were definitely people over the months following that who were supported by further education and awareness, further information on the benefits of vaccination to protect their communities. As well, many people had questions for brand new vaccines. This is reasonable on the science, on the safety of the vaccines. And we've tried to address that, tried to provide more good information over time as we continue to promote vaccination into all of the different age groups that it's available for. And we've seen continued uptake through that. And of course, in recent weeks and months, we've seen that with a very transmissible Delta variant, perhaps 2 or 3 times more transmissible than the variants we were dealing with early in this year, the fact that the more transmissible the virus, the more coverage we need to achieve that community immunity, that herd immunity that people talk about. And so we've tried to increase the rates, never setting a final goal, but always increasing those rates higher still, and finding that in fact we do need to when we're looking at a very transmissible Delta variant. So now we've moved to other measures, and we'll see, have seen mandates for vaccination in certain discretionary settings. So going to a restaurant, going to indoor entertainment events and so forth. We've seen the arrival of mandates to be vaccinated to work in health authority systems, including the long-term care system or the hospital system, and more employers taking this on. So I think that the state that we're in is just a new phase as we've continued to try to get to that higher and higher coverage with vaccination, noting that we had tremendous enthusiasm for that in the early stages. Most employers, I'll say in the health sector where I work, we find that most employees who've been vaccinated welcome it. And many people actually have stated already that they feel safer knowing when they go to work that everyone around them is vaccinated too, and they feel better for the impact that's going to have on their patients, the customer, if you will. So this has been something that's been welcomed by most, and we're trying to continue to work with that as we roll it out further.
Thank you, Michael. No, and you've made a very good point in terms of the virus changing and the transmissibility of the Delta variant being higher. So protection being even more important. So, I mean, really excellent outcomes in having a vaccine, to be able to protect us. So, Stephen, you've shared that you've decided to roll out your policy in tandem with a key competitor. Can you talk about that and really, tell us why and how did you do that?
Thanks, Lisa. Once we made the decision that we wanted to roll out a vaccine policy, we actually changed it to vaccine directive. We were looking to see how do you build momentum across an industry. In our industry, we share many of the same subcontractors amongst our competitors. And we have felt that if we could get some momentum and work with some of our other major competitors, that we could really help do our part across Canada and get this out across the business. So we understood a few companies, and PCL most notably was one of those, was looking to do the same thing as we were. So we approached them to say, hey, we're looking to do a policy. Are you looking to do a policy? And they said, yes, we are. And so when we started talking, the mandate was roughly pretty much similar to what we were both looking to do. And so we thought that we would have more power together if we implemented and we rolled it out across our business areas on the same day. Now, I know, Lisa, you said across international. I would say, we've pared it down a little bit, and I'll talk a little bit about that coming up in some of the challenges section. But right now, we've withheld them to just Canadian operations right now. Basically, get good at a smaller sample and then roll it out to a bigger population. So when we rolled that out, it was really just getting together with the other contractor, PCL, to issue the media statements and to roll that out across the organization. And it actually went pretty easy. The challenges all come after with, actually, listen, partnering with people to implement a mandate is easy. That's probably one of the simplest things. The hardest thing is when you actually have to develop it, see what the scope is, and then implement it. And I think that's an area, Lisa, when we have our next question, I could really expand on.
No, absolutely. I mean, I think, where health and safety intersects outside of competition, I think it's really nice to see that partnership, because health and safety isn't a competition. It should be a shared learning. It's all about how do we protect people, whether they work with you or your competitor. I think those learnings and shared learnings are important, that we foundationally, align on from a value perspective. So it's nice to see that you're able to open that conversation and kind of work through that. Did you have similarities in terms of the policy itself, or can you talk a little bit about that?
Yeah, absolutely. So we both were applying it across our Canadian business models. So that we started looking at common dates on when did we want to do it. We originally wanted to roll that early September, and then we had we just weren't ready in terms of our communication plans to get that out. So what we did is we settled on who's it applying to in terms of scope. So the scope was the same. And then what dates are we going to roll that out? And then we started looking at threshold dates for implementation. And we aligned our dates together, and then we aligned the endpoint. And so So the policies for both our companies is effective. Well, it was effective back in early September, but the mandate to be fully vaccinated for both our companies is November 1st. And so leading up into November 1st, come Monday, speaking for Elliston specifically, our workers need to be fully vaccinated to maintain employment with us. And the challenges leading up to that, probably for both our companies, was very difficult. I could say, speaking with PCL and ourselves, one of the things that we had to do when we went through that was understand how many people actually are vaccinated. What is the number? What is the risk to us? Do we have 30% unvaccinated or more? So we both took different mechanisms. One of the things that we did is you can download a web version called Canatrace off the web. And we use this web-based platform, and we wanted to keep it third party so that we didn't have any disclosures on our own servers. And so this was a secure third party hosted server, and it was a QR code base. And we each had different mechanisms. We used Canatrace. I'm not too sure what PCL used. And we got all our employees to declare what their vaccination status is, whether they're partial, whether they're fully vaccinated. And that was it. We did not give them an option to say, I don't want to declare. If they didn't declare, we made that decision that they were called unvaccinated. The harder part for us was as we gave them a 2-week window to actually do their declarations. And then towards the end of that, we found that there was probably 40% of our population that we ended up chasing that didn't declare. And that took a lot of follow-up from everybody. But once we got through all the declarations, our numbers are probably very similar to yours. If you take a look at your business, we were around 90% vaccinated and 10% unvaccinated. It changes a little bit, but the challenge from there was then trying to separate who's partial, where are they in the process, and who's going to complete their doses. One of the interesting thing is just because someone got a partial dose didn't mean they were actually going to go and complete their vaccination.
So what was that differential between when you put in the policy in terms of, did it increase the number of vaccinations? Did that actually make a difference?
I'm sorry, could you repeat that? I didn't hear.
Yeah, so when you move forward with an announced vaccination policy, did that make a difference from that, was it the 40% then that increased to 90, or did you in addition increase vaccinations from that 90% to say 92 or 93%? Did it make any difference in terms of, did you see more and more people get vaccinated as a result of the policy?
Yeah, so I would say I always refer to what I call the 5 percentile. There's 5% of your population base or not that no matter what you do are not going to get vaccinated. And so from that 5%, what you're talking about, Lisa, is through a mandate and through saying goodbye to employees, will you leverage that? And so we've seen that 5 percentile has now dropped to 2%. So we'll likely say goodbye to about 2% of our employees based on the vaccination mandate. But you're right. When we implemented the vaccine mandate, we did see an uptick in declarations of vaccinations. But then I think we went through a process where the employees looked at us and said, are you serious? Are you really going through with this? Is it going to happen? And it was pretty quiet. And so then I think what changed is we did more and more communications. And then our CEO sent a note out to all our employees to say, listen, we really value you, but come November 1st, if you're not fully vaccinated, we're going to say goodbye. And then it was really that hard message. And then once employees got that hard message, we saw more people. But even up to today, where we have our mandate coming out for Monday, there's still employees that are saying, I might get it November 1st. So we've got a very small percentage of people that may consider getting it, but we've probably got 1.5% are hard-nosed, no matter what, we're never getting a vaccine. And so those employees will move on.
Now, you've already talked about or just alluded to some of the challenges, because that must be hard. Can you tell us where some of the biggest challenges and roadblocks have been throughout the process?
No, thank you. I think, from a personal perspective, you can have really great employees that have really done well for the company. And based on personal choices, you're going to say goodbye to them. And so I guess from a personal perspective, having the multiple conversations with employees, trying to work with them to see, why don't they want to get a vaccination? And so working with them. So we partnered with the Cleveland Clinic. We're not doctors, so we made sure that we could provide resources to our employees so that they could have one-to-one conversation. So we went and we developed in partnership with Cleveland Clinic the benefits of vaccines. Why should you get a vaccine? And so we've done that. Then you've gone to the one-to-ones. So that part has been difficult. I would say the exceptions are difficult. And you have to have a very strong process on exceptions, because what you'll find is the people that don't want to get a vaccine initially, they'll all put an exemption in. But when you start looking at, what's a valid exemption, they're very little. And we've taken the approach of largely allergens or anaphylaxis to the ingredients. Is what we've taken. I don't believe we've taken any religious exemptions at this point. And so that's been pretty hard, Lisa, I would say. If I want to kind of get into like all of that, I would say when you're setting up the program and the challenges are there, you have to create a privacy committee that the employees can submit confidential information to a small select group of people, and then create a third-party mechanism that then you can take medical records and have a reviewer. And we, like I said, we use Cleveland Clinic so that they can review based on our criteria and then come back to say, hey, is this exemption there or not? The education has also been the challenge. From I don't want to get an mRNA because there's a microchip in it, and literally employees say that, or the mRNA, I'm a breastfeeding mother and it's going to transfer into my child. And no matter what science that you talk to them with, a lot of them just don't believe the science, and they don't believe that it's not going to transfer. So those have been some of the challenges as well. We didn't have any death threats yet, so that part's been good.
Thanks, Stephen. Yeah, nothing has been easy. And Michael, maybe commenting on that. I mean, is there any similarities to healthcare as what you've seen, and how has healthcare approached this similar strategy?
Yeah, I'm glad to talk about that. I mean, when you look at the vaccine coverage in healthcare, it's been high, but not perfect. So well into the 90% in terms of coverage for fully vaccinated people, but depending on the setting, which hospital, which group, are we talking about nurses or doctors, the percentages might be around 93, 95, 97%. So high, but again, with a critical amount that have not been vaccinated. This is compared within BC, on the whole, we have an incredible 90% coverage with a single dose, 85% with, or 90% with single dose, 85 with 2 doses, and higher still in Vancouver Coastal Health. So this is high coverage within an already very high coverage setting. So in healthcare, that we have seen the importance of having what we believe will be the benefit of having total coverage within our staff to protect staff themselves, in turn to protect their patients. And as I mentioned, most of the responses that we've had have been very supportive of the mandatory vaccination policies. A small minority of people with different feelings about it. And in fact, many people who hadn't been vaccinated, with the arrival of these mandates, have proceeded to be vaccinated. Some of them had gone to their primary care physicians, have talked to public health physicians like myself and others to counsel around potential medical contraindications, around reactions to a first vaccine that might be dissuading them from pursuing the second vaccine. In many cases, have found that they're able to have that second vaccination safely, which is a very positive thing. We think it's good for their health, for the protection of those around them as well. And so we've actually seen very bump in uptake of vaccination leading into the vaccine mandates in the healthcare sector, which has been really, really quite positive for us. I think that one thing that we do have is some of those same challenging conversations. We have, in many cases, devoted healthcare workers, people who have been on the job for a long time, who, for one reason or another, are not yet fully vaccinated. And I think that that's one thing that every supervisor, every manager, and who's in that position has had to work through. But as a public health program, we want to be there for people, and we can have those conversations to sort out the reasons that people are considering. In many cases, the reasons that people are naming, some of the things that Stephen had brought up that really resonated here, somebody who's pregnant or nursing a mother, somebody who might have pre-existing health conditions, those are often very good reasons to be vaccinated. They can in fact be risk factors for severe disease due to COVID-19. So we really want to explore the reasons why not. We always say somebody's fear can't be wrong, but sometimes the information that's informing it can be better informed. So we want to really work with people when they describe the reasons that they're not vaccinated yet.
So what would you say, Michael, would be considered for real medical contraventions for getting vaccinated? Can you talk a little bit about what that would precisely be?
Yeah, so the main and really the only reason, we have a lot of applications for medical exemptions, and when they're evaluated, many of them turn out not to be firm contraindications. But an anaphylactic reaction, which can be life-threatening to a first dose of one of the vaccines, for example, would be a good reason not to have that same dose again. There are other vaccine products, however, so if somebody has had one of the vaccines, they'd certainly be eligible to consider this a different vaccine the next time. Many of the reactions that we've seen as well, when people are vaccinated a second time, they're able to be vaccinated safely. We might create safe conditions around that. So some people might be vaccinated not at a mass clinic, but some people even in an emergency room or in the presence of a physician, enhanced monitoring around that. Usually with a close assessment, we can find a way to make sure that second dose is safe if somebody's had a reaction to the first dose. But overall, there's very, very few situations which someone truly can't have a dose of any of the vaccines.
Can you comment on if there are any legal ramifications to employers for asking employees to declare vaccination status or storing this information? Because certainly there's been a lot through this process that we've had to do.
Yeah, and this is something where, of course, on a public health perspective and the health authority that also is running the hospital system, we work closely with our legal teams, with our ethical teams, with our privacy teams to make sure all of this is done. So we're not looking for information that's more intrusive than necessary. So for example, people would not need to disclose to an employer the intimate or personal details of a contraindication to vaccination. Thus, it's either they've applied for medical exemption or not. Either they have one or not, and either they've been vaccinated or they haven't. So we're not looking for more information than is necessary. And I think that that's really a crucial thing. That when we talk about what could be characterized as, again, needing to provide personal health information to an employer in some form, whether or not one's vaccinated, that this is only the information that's necessary for the public health benefit that's been described in this order. So I think that we do try to take that approach of minimally intrusive approaches. We're not trying to ask for more detail than is necessary. And I think that that's what's helped keep this order in a place that the provincial health officer, as they've described, considers different rights and freedoms around privacy, but is able to manage that into balance with the public health benefits that we're seeking.
What do you see as some of the current longer term implications for the community and for employers as it relates to vaccinations and the changing RNA virus? Can you just talk through a little bit about what to expect?
Yeah, I mean, great question. I think many people have started to see this already. There's been a lot of commentary or media discussion will describe how the Delta variant is smart and it will find the unvaccinated, and we won't give it that much credit. I think that there's some truth to that, in that in an exposure, say somebody who's infectious doesn't know it and spends some time at work, some people who are unvaccinated might be an order of magnitude more vulnerable, more likely to be infected than people who are vaccinated. We're talking about vaccines that we're quite pleased to say are 80 to 90% plus effective. So people who we do find that in large exposures, which we can have at workplaces, we can have at major events, we do find that the transmission is, of course, much more likely to move between the unvaccinated. And we have this description of employers or organizers of events that the infection seem to, and our contact tracers as well, that infection seem to flow through the unvaccinated. So I think that even with very highly vaccinated populations, workplaces, we still have the situation where unvaccinated people can be at risk, and those around them can as well. These vaccines are very good, but not perfect, and so we can still see clusters of transmission where there's a presence of people who aren't vaccinated. And one thing that we've found, and many employers have as well, is that the implications of a cluster of cases, having many workers off sick at once, many needing to isolate because they're close contacts to a case, can be really damaging to the day-to-day work of an organization, really damaging to people's day-to-day lives in terms of needing to isolate, being unable to work, carry out family functions, other important responsibilities that we might have. And I think that in British Columbia, we've really tried to take the approach of being targeted in our interventions. So when you see restrictions on different areas of life, on business and so forth, that they're really looking at where the risk is. So we've seen, for example, nightclubs closed to their normal operations while restaurants might still be open. We've seen that there's certain safety plans or restrictions put on some businesses without full closure. And when there are closures of workplaces, of a specific workplace with an outbreak, it's really based on evidence of high risk. So being able to stay open, to keep running normally is of course to the benefit of the employers and the employees alike. And I think that having a fully vaccinated workforce, that we'll see certainly employers and employees really realizing that benefit, because the risk really goes down once you have that very high vaccine coverage. And we've seen this in the long-term care context when we have a totally vaccinated workforce, that the risk is much lower.
Are you concerned that, perhaps we're stepping on boundaries as it relates to, an individual being vaccinated and requiring them to be vaccinated in order to stay at work? Has there been consideration for that in terms of just the legal ramifications or potential legal ramifications for those decisions? And really maybe asking both of you that question.
Yeah, I mean, I'll take it away, and I'll be interested to hear Stephen's thought as an executive in his role as well. One thing that we have found with you'll see the provincial health officers' orders around healthcare workers, people working in hospitals and long-term care and so on. And it actually spends quite a bit of time looking at legislation, things like the Charter of Rights and Freedoms or other important legislation that deals with people's privacy, that deals with people's freedoms, and balances that carefully with the public health benefits. So it's something that I think we need to always proceed with an awareness of this. And as I had mentioned, not ask for more information than is necessary to get to those public health goals. But I think that we've found, again, not being a lawyer, but a doctor, we have had good support from our own legal experts within Vancouver Coastal Health. And we've seen this across the country, that many of these mandates, when they're constructed carefully and with due consideration to privacy and confidentiality, and they do have exemptions, appropriate exemptions, that they've largely been upheld and found to be reasonable.
Thank you, Michael. Steve, your thoughts on that question?
On the legal, yeah, I mean, that was hard for us as well. When we went through our internal and external legal in the terms of a pandemic, as long as we weren't storing and collecting their receipts on there, then collecting information on terms of if they're vaccinated or not was acceptable, but not to be housing all their records. So that's why we went to a third-party system, so we tiered ours a couple different ways. The first step was a self-declaration to just get the employee to declare. And then the second one will be to have the employee upload their documents on their own device, and that for sites that require, some of our clients require full vaccination, that they wouldn't issue it, but they would simply hold up their mobile phone, and then they would show proof of vaccination. So then it's not in essence monitoring, because they're showing it just like you would for a bar or restaurant to get in. You're showing proof of validation of vaccination, and then you're coming in. The bigger part for us will be the auditing, and because there is already some fraudulence with people false reporting, so that obviously they don't lose their jobs. So we'll be doing a full. We'll be going through every employee from an audit perspective to show their records. Similarly to to our rapid testing program through the challenges that we had that was upheld for us. We think it's the same mechanism. Initially, what came down was employers can't require and can't mandate rapid testing to enter the premise. And so we found that, yes, we were allowed to do that. And we believe through our legal means that the same holds true with the mandate. Now, listen, it's a little bit of a play on words. They can choose not to get vaccinated, but then they don't have access to the work location. So our approach has been to have access to a work location, you must be fully vaccinated. And so we've taken that approach for those who work at home right now during the pandemic, because at some point they're going to be recalled back to the office and they'll need to be fully vaccinated to come back. If employees are on leave for maternity, parental, or others, the same would apply. The same would apply to them. Yeah.
Are you going to still utilize your rapid testing within your organization in addition to the mandatory vaccination policy?
Right now we are. We've already seen and has caught some breakthrough cases for us. In our bigger offices, we test twice a week. We do self-swabbing. Listen, in BC, it's a little bit more difficult. In Ontario, for us, we have a little more access to the kits, and we're able to do a lot more self-swabs, which is actually pretty convenient for us, because the employees come in, they get a swab from the reception. We have testing rooms that go in, they test, and then they report out on what their result is. And then we report weekly to Ministry of Health of what the results are. So the rapid testing for us has been actually very positive. Maybe just to go back to that, we had one work site where, this is where you have to work very closely with public health. They were going to shut down the entire work site. And we started looking through the rapid screening. We identified 20 workers over a 2-week period that were asymptomatic. We were able to pull those out of the workplace before they had rapid spread. And then through the constant testing program on the sites, was be able to say, we have care and control on the site. It is not spreading. We've caught the people that we need to catch. And then we've continued operations, or you shut down a small sector of that.
That's very helpful. Michael, do you have any experience in utilizing the same kits here in BC?
Oh, sure. Yeah, a number of different sectors have deployed rapid testing. We've done some work to promote rapid testing earlier this year in construction. In fact, it was one of the sectors that was identified as potentially benefiting from the rapid test kits, and they can be very helpful. As we know, as Stephen has described, people can certainly carry maybe a third, maybe a half, depending on on the study, can carry an infection without any symptoms at all. So of course, that's been one of the absolute Achilles heels of our pandemic response is the fact that people who can have silent transmission for some and very severe disease for others. So the benefits of rapid testing in those communities, there's a BC rapid testing strategy, and the availability of rapid tests to employers who want to apply it has been helpful in some contexts. As we increase vaccination coverage as our primary tool, we found in many contexts that the rapid testing, the relative benefit of it might not be as high now as it was back when there was such high coverage. So, giving healthcare context, we saw in some cases rapid testing perhaps averting transmission, finding workers who did not have symptoms but were infected and surrounded by people who weren't vaccinated earlier in the pandemic. So that was situations where we felt very glad that rapid testing was in place in those. And I'd say the same was happening with the University of British Columbia's pilot of rapid testing at the time. We had a largely unvaccinated cohort of young people living in residence and otherwise in close contact. And rapid testing was actually finding some cases and potentially averting those chains of transmission. More and more so, we're seeing that with vaccination, that we just don't have the rapid testing programs aren't picking up nearly as many of those cases. And so it's very possible that it might not have quite the same role in a fully vaccinated workforce as it did in a partially or a non-vaccinated workforce over time. But I think that it's wise. What we've seen in many contexts is not just removing a tool wholesale, adding a new tool, having both at once, maybe with some overlap, and then taking out the other. So I think that while many many workplaces have done a very good thing to put rapid testing in place. Adding vaccination now, getting to that very high, even 100% coverage, as we're seeing many aiming for, is going to be excellent. And I think that in time, they might be able to remove those rapid testing programs because it's just a different ball game when you have an entirely vaccinated workforce.
Excellent.
May I add, I would
Sure.
say there's no one tool is going to beat this thing. And so, exactly what Michael had said is it's a multiple of tools that you have to use. And what we found, we do have one manufacturing facility, and we find that the trade level, for whatever reason, the percentage of unvaccinated along the trade floor is a lot higher. And so in that one facility, we actually have nurses there that test twice a week. And if they get a presumptive positive on a rapid test, they then do a PCR test and send it off to a private lab. And we did that for two reasons. One, again, it's protecting workers, but two, from an operational perspective, we have workers working in tight, close quarters, and that if COVID did go in there, it would go through fairly quickly. We do find sector specific, depending on the trade level, the degree of folks that are vaccinated.
Interesting. Layers of protection as we talk about this, right? Making sure and really being vigilant on all those pieces. So now moving on to advice. What advice do you have for employers who are making these decisions today around vaccine policy for their businesses? Stephen, can you talk a little bit about that?
Yeah, keep it simple. And let me just kind of go through. When we first did this, we had these great plans to get everybody. And we had multiple phases and multiple stages where, a first phase was you could be fully vaccinated, but come onto a site if you took rapid testing. And then there's a second phase and then a third phase and a cure. And then we were going to bring our own employees on, and then we're going to bring our hourly and our subcontractors on. And what we found was it was too much too quick. And so the advice would be get good at a smaller group. So we pared it down to just our salaried people across Ellis Don, so around 3,000 employees across the business right now. And I could tell you that's hard enough right now, just dealing with the exemptions and going through saying goodbye to employees and turning off access to equipment and recovering and then trying to backfill and recruit. Now you throw in a different dimension with hourly and then your subcontractors. So it's take it a bit slow and make it simple. So we went to a process where we just said, hey, come September 21st, you need to be fully vaccinated to enter a work site or agree to rapid screening twice a week. And then come November 1st, you must be fully vaccinated to enter a work premise. And if you're not vaccinated, then you're on an unpaid leave for 30 days. And then we move to termination. It's a bit hard, but that's our process that we learn. The other thing is we all don't have the benefit of having doctors on site. And when we started looking at safety, people are very quick to look at and overscope themselves. But when you're looking for legal challenges against you, you have to really make sure you have sound advice on your exemptions. And you also really have to follow the privacy protocols. So we kept the list of vaccinated, unvaccinated to our senior most executives and our legal department. And then when we started getting into medical files, I even removed myself. We only have two people in the company, one senior HR and one legal. And we created what we call an ED privacy email, which is a dedicated email that only those people get, where there's a consent form for the employee to release medical information, which we then give to a third party that based on, in essence, current parameters of exemptions. And they would go through and they would provide us advice to come back. And what I would say from a learning from there, just because, forgive me, a doctor comes back and says the exemption is not accepted, doesn't mean that as an employer that you can't, but it's a slippery slope. You want to follow your process and you don't want to grant too many extra exemptions than what you have, because then your program loses its confidence. And so probably for us, the biggest adaptation we have would be with pregnancies. So we have a number of employees, let's say that coming due December 1st. So our policy applies now. Would it make sense to terminate them now with 30 days? Now we know from pregnancies and others that they are at higher risk and they should get a vaccine, but it's a very individual approach in that some people in their last trimester are still having medical issues or they're losing weight or whatever those would be. And so what we've said is we'll provide an accommodation for you for those 30 days to get you up to your maternity leave, but you need to be fully vaccinated when you come back. So we'll make an adjustment, let's say, from that. But true actual medical leaves through all our employees, I think maybe we have one or two. It's very, very, very small. So make sure that you have doctors, you create privacy mechanisms. You have provisions for those that are not fully vaccinated that you can continue to do some sort of testing, which we have access, and you probably do in manufacturing as well to rapid screening. The other advice is, as you're talking to employees, not everybody is sold on an mRNA. And what we found was we had employees jumping on planes and actually flying to San Francisco, and they have a Johnson & Johnson clinic right in the airport. So employees would fly there, literally get off the plane, go get a Johnson & Johnson shot, not even leave security, turn around, jump on the plane and come back. And so it was more about they wanted a traditional viral vector than an mRNA. So the education process through this is and listening to your employees is huge. And it's not that they're all anti-vaxxers. What we also found, there's a lot of anxiety where people just don't want to. But through talking to them and creating, my lights went off. Hopefully you can still see me, but creating education documents on the benefits of vaccines and covering off pregnancies, breast milk, like all those key questions that you think your employees will have, and put it together in a package is really helpful. Understand you're going to say goodbye to people. And it's important that you have your legal team review your documents. And we found that having what we call the 30-day cure period was good. So you set your policy, you keep your policy. You have people sit for 30 days. You make the non-vaccinated people go through training. You provide the one-to-one. So when you come by to say goodbye to those employees from a legal standpoint, you've walked through a lot of the steps that you need to have to say goodbye. The intent isn't to say goodbye, but you have to realize you will have 2 to 3% that just no matter what will not get vaccinated. The other thing we saw, probably just as a learning, was we started to pit the vaccinated against the unvaccinated. And we started to create workplaces where if a person was unvaccinated and they knew that, they just didn't want them in the work site, or they wouldn't show up themselves. So keeping the confidentiality of who's vaccinated and not is extremely important. Generally, we find that people know, but as a management team, you can't disclose that. You have to keep that very tight.
So Steve, when you did terminate, do you terminate with cause or without cause? I mean, how did that?
Yeah, that's a great question. I can't answer, but I can answer in a few days, but I can't answer today. I would say, here, and I know it's a bit of tongue in cheek, we're in the final decisions of if we're going to terminate with cause or without cause. And we're deciding that next week. What I can tell you is a lot of companies are terminating with cause. And also termination with cause, for the HR folks on here, we've been given codes that we have to use for reasons for dismissal. And those employees won't cover for unemployment insurance benefits if they're released because they didn't follow a vaccine directive. So that's an impact to them.
So in terms of boosters that are coming up, I know they are here in BC. Do you anticipate requiring the boosters as well? Has that even been contemplated in your process or policy?
Yeah, we wrote the policy broad enough to say that it wasn't dependent on government. It was dependent on us. And we defined in our policy the definition of what a fully vaccinated person is. And so that definition can adapt and change if the definition of fully vaccinated changes. So if the definition of fully vaccinated means you now must have a booster, yes, indeed, we could go back and require our employees to get a booster. What I can tell you that's working against us right now is, at least in Ontario, they've announced a lot of lifting of restrictions coming March, and we haven't even got out our full digital vaccine passport yet, and they're already talking about trying to get rid of it next year. So that your hesitant people are like, maybe I can get myself on a parental leave and leave myself out of this, and then come back in 6 months when this is all done and stay unvaccinated. So that's been a bit of a challenge with us for the last few people holding on. And that's where you have to be strong to what your values are as a company. And so where we've got to is from a values base. If you're going to say goodbye, you can't just turn around and hire them 4 months later because now the province says you don't have to be vaccinated anymore. That will do more to harm your business and others. And let me rephrase this. Like you probably spend most of your time on 5% of your employees, but don't forget about the 95% of your employees that have come to you and said, thank you very much. Like you, we have folks that have autoimmune disease and they haven't been in the office. And then they were so thankful when they got 2 vaccines and now they're getting a 3rd, but they're still coming in with KN95 masks. They're still well isolated from others. And as we let unvaccinated people in, we're actually potentially doing harm to those folks that have other underlying conditions like cancer or Crohn's or name whatever that is. So look after the 95%. They're the part of the business that's going to keep you going. Be kind and firm with the 5%, but hold on to your values and move forward with that. That would be my advice.
Thank you, Steve. And Michael, can you talk a little bit about here in BC about where you anticipate the boosters to be integrated within the current policy in healthcare? And just, if you have any more information on where you anticipate our vaccination app, which is what we have here and that many others have in terms of British Columbia, and to be able to access workplaces. Do you have any thoughts on that, Michael?
Yeah, sure. I mean, just to make sure, making sure everyone's on the same page in terms of the booster program in BC, you'll probably be aware it's been announced that everyone in British Columbia, 12 plus, is going to be eligible for a booster. That's proceeding in terms of risk and in terms of when someone's last dose was. So first of all, people in long-term care, assisted living, certain healthcare workers, people who were vaccinated very early on at a short interval, back in December, January, February of the previous year, are those who are becoming eligible now. And then people, this will more or less flow in terms of close to the order of people who are vaccinated in our initial campaign. And by early 2022, most of the population will have become eligible for a booster if they've received their first 2 doses. Now, right now, there's been no indication that that's going to be part of the vaccine requirements, either for work in healthcare or to satisfy the vaccine passport, the vaccine card for attendance in discretionary settings, as we had talked about before. So your things like restaurants or events. Right now, this is something that's going to be available and recommended to many people, but has not been made part of the definition of fully vaccinated. And I think that, with all things in COVID-19, I think it's always wise to say at this time, in terms of where 2 doses stands as protection in the new year, in terms of our new variants, we always say there's only so many that we know of right now. There could always be more. So I never would want to say that as of in June of 2022, 2 doses will count as fully vaccinated. It's always possible that we could see an ongoing series of vaccinations. We might be at a stage where there's not this requirement to have vaccination for some of these contexts in the future. But I can say right now, this is being offered and made available, but not part of the requirements. It's not imminently going to be added as a requirement to be fully vaccinated, which still remains 2 doses with the approved vaccines in BC.
Thank you, Michael. Very helpful. Now, just talking a little bit how Vancouver Coastal Health can support employers with information, education to support employee vaccination. I know there's been, certainly from our industry, we've had requests. So just asking you, Michael, how can Vancouver Coastal Health possibly, help support that opportunity?
Yeah, I mean, we hope we'll be able to in some of the ways that we've tried to throughout the vaccination campaign and the pandemic. So we have some relatively high level tools and also some more on the ground ones. So even prior to this meeting, Lisa, we've been planning, and many of your members in MSABC will actually be receiving a memo, a letter that they can circulate to their employers, to their employees, to the entire workforce about the booster campaign, making people are aware of this and that they can how to access vaccination. So that's one thing we want to communicate very clearly, recognizing many employees who are vaccinated through our special clinics for manufacturing and other sectors, food sector and others, in say March of 2020, might not have had to be registered in the same way that the general population was. We provided this special access early on to manage the risk where it was occurring, but it's very important that people know that they do need to register in the provincial program. Most people have, but some haven't, and some people who didn't the first time around will need to now. So this is communicated in bold print, and we want to get that out to all of your members as soon as possible, just so that they're in the system and they get the email, they get the text message to say, come and get your booster dose when that time comes. We don't want someone to miss it because they're not in the system. So those high level communications will flow. Hopefully you'll be seeing that not before long if they haven't come through already. And then in terms of direct support as well as these larger sector meetings and conferences and contexts like that, we want to be available and often have made ourselves available, both medical health officers, our nursing staff and others, to speak to oftentimes smaller groups. So if there is a workplace that could use some support, that could use a physician or another public health expert to talk about these issues, we've presented those in many different sectors, from education to healthcare to manufacturing. So we can talk to workplaces. Of course, in our electronic age, it's nice to benefit from the ability to address many people at once. We don't want to do that in an organized way. As I've mentioned, we've had meetings, sector-wide meetings with construction around rapid testing, for example. So if we have specific questions that are coming up over and over again, or a group of people who are having trouble with that decision around vaccination or might need more information, we want to be able to present that in a direct way. So I consider us available, and as well as that, sometimes data can be a support as well. So if we want to continue making tailored reports that are available online. So if there's ever questions about what's happening in the sector right now in terms of transmission, in terms of infections, when we receive that kind of request, we try to build out our website so we're having good, transparent reporting about where transmission is in BC right now.
No, excellent. And I just want to commend you and your team for all your help throughout the pandemic and your continued support on communications and information. It really has been invaluable. And I want to thank you once again for that. So moving over to the questions from our audience, and thank you all for once again being here. The first question goes over to you, Stephen. Does Ellis Don offer wellness clinics, including flu shots and other prevention information and other strategies, such as blood pressure, sugars, and those types of clinics through partnerships with community health units and private suppliers? Do you offer that overall? Is that part of your annual program, Steve?
Right now, we're currently just doing the annual flu vaccinations, and so we absolutely are doing that. Would like to get more into the wellness, but for now, it's just the flu vaccinations.
Okay, thank you. As a company that is not mandating to require vaccine passports, would we need to prove that it needs to be a bona fide job requirement for certain jobs in order to avoid issues of perceived discrimination? So this is potentially over to you. Steve, do you have any thoughts on that question? Did you walk through that? Is it required based on your job requirements, and maybe healthcare being a different perspective, immersed in health and being on the front lines with?
I think this is just a personal perspective that any company can implement a vaccine directive, yeah. But you have to develop why you're doing it, what the risk is. You have to be consistent in the application. For our business, it did make sense because we work in hospitals. We have critical infrastructure programs where we need to. We have some manufacturing in tight places, and that made sense. But even in our office, we have about 500 people in our corporate office here, and so we're just office people. But to provide a health and safety workplace, we looked at this saying as this is something that we need to do to provide that safe place for everybody. And so yes, so we have looked into the legal aspects, and from our legal reviews is our belief is that yes, the employer can implement it, and so we did.
What do you think? I mean, being a global company, and you said, Canada is the pilot, if you will. Do you have any thoughts about how you're going to review that pilot and where you go from there as an overall organization? Have you kind of thought a bit of a roadmap to that, Stephen?
Yeah, so some of it goes down to, I spoke to momentum earlier. I mean, there is a business side to all of this as well. I mean, first and foremost, we're trying to protect our workers, but a lot of our subcontractors is a shared workforce that don't just work for us. They'll work for us for a project, and they'll work for other folks. So part of our strategy is look after our own teams first, but then really continue, and this is what we were doing with the other large competitors, is create momentum with other companies to implement other similar programs. So what we have been doing is we've been helping a lot of companies on return to work programs with specifically here in Ontario, rapid screening, or what does return to work look like, or what does your vaccine mandate look like, and how would we go through? So we're trying to provide some of our experiences to other folks that want to go down that road, and we'd be happy to help provide some information to yourselves as well.
Thank you very much for that offer. I mean, it's such a complicated time to be putting in policies. There's so many with the changing environment around us. So looking at, and maybe this question is for you, Michael, looking at risk control, weighing PCR tests versus vaccinations. Can you just comment, very simply of those differences and why vaccinations is really what has been chosen by healthcare and other organizations?
Yeah, it's a great question. And we've been talking right through the pandemic about layers of control. And Steve really wisely mentioned early on that no one tool is going to do it. No one tool has done it. There's no magic bullet in terms of preventing a virus of this nature. And so some of the things that have been applied over time, social distancing, whether by education and awareness and people's personal practices, or by regulation through the closure of certain contexts, like certain indoor spaces where physical distancing might be challenging. We've seen masking, again, either through people's choice or through mandates in different contexts. Vaccination, obviously, one of the tools that we've been discussing a lot today. Contact tracing, finding people who are either infected or who potentially infected, contacts of people who are infected, requiring that they isolate and quarantine at home. So all of these are going to lower the risk of transmission to some extent. Now, and each of these can be quite variable. So you look at the use of a mask, it's definitely impactful. It does depend on the user wearing a mask, wearing it properly, wearing it all of the time, and judging when they need to. Things like social distancing. This requires, again, that people constantly are deciding to put that distance between themselves and others. It could be, if we're talking about context, certain workplaces, public transit, certain indoor spaces where it's not possible, or that it's like severely limiting to the operations of certain spaces that we want to continue to operate. Vaccination is one thing that we can have that once that's applied. Let's just say, for the sake of discussion, a 90% effective intervention, that once that's given, that is effective at that rate all of the time. That is a 90% effective mask, if you will, that somebody always has on. And so it really has that benefit in that it's a constant intervention that's there. It doesn't require that variable individual application from hour to hour, day to day. And it's something that, if we can get to a very high rate, protects not just the user, but the entire potential transmission network, if you will, the community around them too, by getting to those high levels of transmission. And we've seen this with really low rates of transmission in some of our communities that have gotten to the very highest rates of vaccination coverage. I'm happy to say a few of them here in Vancouver Coastal Health, we see quite low rates of transmission. So it's really effective, not just for the user, like a mask might be, but for all of the people around them, even at several degrees of separation. So it's not the only intervention, even at this time. We have other things in place, restrictions in different parts of BC and other measures in place, but it has certainly become our primary tool for those reasons.
No, thank you. I mean, we use the terminology engineering versus, administrative or, PPE being at the front line. So in essence, vaccinations being the engineering kind of form of control or higher form of control to support or to manage the risk, right, of transmission and illness and disease.
Yeah, absolutely.
So just looking at any other questions that we have. So Steve, does anything stand out as something you might do differently if you could go back? Is there anything in your course and of course we all have 2020 hindsight, but anything in particular for you, Steve?
I think if we had, time is always something that people could have more of. Understanding how many people were vaccinated before we implemented the policy would have been quite helpful, but we were trying to basically run and chase people down to declare what their vaccination status is while trying to roll out the program at the same time. That was difficult. The other thing would be, because we have lots of industry peers, was to spend a little more front up time working to try to get other general contractors along to put it out. And that's a good and bad. I mean, if you try to get everybody together, it could be forever before you get it done. But at the same time, if you had more people doing it, you could roll it out to a broader group of people. So that.
No, absolutely. And we talk about communication. What strategies did you use in terms of communication to get such pertinent information to so many people and just have that two-way conversation? I mean, you have a very large workforce.
Thank you.
So what are those strategies that you used for communication? I mean,
I'm sorry.
Town halls. I'm just curious to see how you could do that so well.
Thanks. So we have an internal portal. I mean, you can't just put a message up on your company website and hope people read it. So we did a couple things. So myself, we use the all employee email. I would put a message out. Our CEO would put a message out. We would do constant follow up with that. You would take your key executive teams and then the layer below it with your senior management team and hold lots of information meetings like every couple of days in terms of where you're at, and then have them work operationally within their groups to roll that out as well. So you had multiple conversations with the leaders with their teams. And you made that available. So that was pretty helpful. And then in the end, I think probably the final is a lot of what I'd call one-to-one. So with the hesitants, it was daily follow-up with the leaders of understanding, who is what we would call the hesitant. And so we would then reach out to them individually and talk to them. So a lot of daily calls by key leaders to split up the list and just have those heartfelt conversations. In fact, I'd have employees calling me all throughout the day. There is actually a threat part to it in that, and I made a joke earlier, but if people didn't leave voicemails, we didn't return, because they would be, the people that didn't leave voicemails would be pretty aggressive on the phones. But a lot of employees just calling to say, I need to talk to someone about, why you're doing it. And so those one-to-one conversations were pretty valuable, draining, but valuable.
No, absolutely. I mean, here as well. And Michael, please comment as well. I mean, really knowing that things were changing so quickly around us and continue to, and being able to get information to people on the front lines of what does it mean for me? What does it mean for my organization, both at the leadership level, but then that translation down into the people? So absolutely critical. Any thoughts, Michael, on how, what systems do you use in healthcare to be able to get this critical information so quickly through and then through decisions and outcomes?
That's a really important topic. And, we often find ourselves using an all of the above approach. Right now, in terms of communications in this day and age, we find that of the people, if we're talking about vaccination, for example, people who it would be important to vaccinate, our whole population are receiving information through so many different channels, through so many different media in our day and age that we need to look to social media, we need to look to traditional media, communicating through people's general practitioners, their family doctors that they are trusted to give them their health advice, through employers, many of whom we're talking to today. I think that we really try to account for all of those different possibilities. Because when we're trying to achieve very high coverage with the vaccine, which we've achieved in British Columbia, we also need to keep in mind the groups that might be missed, and really thinking of those potential gaps in our programs, and always looking where those exist. How can we communicate to those specific groups, often with community partners as well? That's been a major program that we've applied in Vancouver Coastal Health, other regions of British Columbia as well. So I think that creativity and listening to the community members as well in terms of how they need to hear information and the channels they need to receive it through has been important for us.
Well, I just want to say thank you both, Steve and Michael, for sharing your insights with us today on this very challenging topic. We really appreciate having you here on our main stage. And once again, want to commend your leadership for sharing your experience and expertise with us.
It's a pleasure. Thank you.
Thank you very much. Thank you.
Before we end our keynote session today, I am honored to welcome another guest, BC Minister of Labour, Harry Baines, who's joining us from Victoria. Thank you, Minister, for taking the time to be here today. Minister Baines has been a vocal advocate for workplace health and safety and supporter for the work we do here at the Alliance. On behalf of the manufacturing and food processing sectors, a warm welcome to you, Minister Baines. Thank you.
Thank you, Lisa, and thank you to all of you for inviting me and giving me the opportunity to speak to you and share my thoughts on behalf of our government. I believe last year I wasn't able to attend. My deputy attended, so here I am. I'm really, really pleased to be here, Lisa, and to all of you. So good afternoon. I'm happy to be with you today. I would like to take a moment to acknowledge that I'm joining you from the territory of the Lekwungen-speaking people, the Esquimalt and Songhees nations. It is an honor to participate in the Make It Safe conference once again this year. I want to commend the Manufacturing Safety Alliance for your efforts to keep workplaces safe through the pandemic. And it hasn't been easy, and I know that. And you and your membership have done a great job, and I want to say that right at the outset. Adopting to the measures put in place over the last 18 months, maintaining a safety measures to keep workers and public safe, adopting to new ways of doing things quickly and carefully. I appreciate your continued hard work and resilience. Since the pandemic began, the government has made a vital investment in relief and recovery measures, including the COVID-19 Action Plan and the Stronger BC Plan. We have made significant improvements to support workers, employers, especially during this challenging time. And I remain focused on continuing to provide the support as we move through pandemic towards recovery. With everything we do, we begin by consulting workers, employers, and other stakeholders. And by doing so, Lisa, you and everyone knows that you, after considering all different suggestions on an issue at hand, which would be impacted by our decision, it is important that we listen to them and then we form our policies around them. Responding to COVID-19 continues again to our priority in the coming year. Even though we are well into vaccine rollout, we're not out of the woods yet, and we all know that. We know that pandemic-related restrictions have been incredibly hard on businesses, people, and communities. And everyone is looking forward to putting this pandemic behind us. We continue to monitor the data and look at all options to keep people safe in BC, guided by advice from our public health officials. And I know many of you are weighing the implications of vaccine mandate in your businesses. And as you have just heard, this is a complex issue for many. Evidence shows that the vaccination is the best measure available to prevent the spread of COVID-19. Some public sector employers, including crown corporations and some private businesses, now require their employees to be vaccinated. Employers will not force people to get vaccinated, but in many cases, they can make it condition of employment. They have done that. This will leave some workers ineligible to perform their previous jobs. Currently in BC, most employers still do not have a mandatory vaccination policies in place, although more are choosing to implement them. WorkSafe BC has been advising employers that they may choose to implement staff vaccination policies based on their own due diligence. But it is still up to the employer to decide if they will require vaccination for their employees or not, or rely on other safety measures, such as frequent rapid testing or wearing masks. Employers are accountable for ensuring their workers' safety and should have communicable disease safety plans in place. Given the higher transmissibility of Delta variant, all businesses should review their plans to ensure that they are adequate. Now, workplace safety and workplace health and safety is critical to our economic recovery and continues to be my priority. And I want all workers to return home safe and healthy at the end of their shift. While our focus is ensuring that the work conditions are as safe as possible, when a worker is injured or become ill at workplace, it is vital that they get the support and care that they need through our system. Improving the workers' compensation system, and particularly the treatment of injured workers, has been a key priority for me and this government. Last year, we made improvements to the Workers' Compensation Act, Bill 23, to better support injured workers and their families while keeping premiums paid by employers stable. These improvements, some of them include expediting healthcare for workers before a claim is accepted in many cases, clarifying how the one-year application period for workers' compensation applies to mental health claims. In addition, WorkSafe BC added COVID-19 to the list of viral infection eligible for workers' compensation benefit if contacted at work. Workers are now the focus of the system, and the WorkSafe BC has the tools needed to improve investigations of serious injuries and fatalities at workplaces. We are continuously thinking about how we can strengthen the workers' compensation system, and I always appreciate your input. Improvement that would better support your workers and employers. Now, one of the issues that I want to talk about, Lisa, and all of you, is it is in everyone's mind right now, paid sick leave policy that is being talked about now. And I believe that the workplace safety also includes personal illness and injury. And I think we can all agree that no worker should have to choose between going to work sick or stay home, lose pay. For the first time ever in British Columbia history, we are creating a permanent province-wide paid sick leave provisions for all eligible employees with coverage to begin January 1st, 2022. Now, I understand this continues to be a challenging time for businesses, but we have learned important lessons during the pandemic. And one of them was that the workers who were sick went to work sick, and they brought the virus with them. That spread to their co-workers and their colleagues. Then those workers went home and lived with their families in their communities. Additional hospitalization and many deaths occurred. On top of that, many of the business, because of these spreads at workplaces, many of the businesses had to be shut down. In Fraser Health alone, in April and May, close to 200 businesses were shut down because of the spread. That is a very, very costly. And then also the seniors advocate in her report about 2 or 3 weeks ago identify because workers were going to work sick in the healthcare system and in long-term care. And they brought the virus to them, to the workplaces, spread it not only to the workers, but to the patients as well. And many deaths were attributed to that area. And so it is a human, it is an economic loss without having a paid sick leave. And so that's why we're saying that having paid sick leave is good for businesses, good for workers, and it is essential for public health. We have received input from workers, employers, business associations, labor advocates, and Indigenous partners through online surveys and face-to-face meetings. Public consultation just ended about 4 or 5 days ago. Workers and employers were very engaged in the process, and we received over 60,000 responses from employer and from workers and others who are really who think that they would be impacted by that policy. So we are evaluating the field feedback we received, and we will use that information that we received to develop what kind of paid sick leave model and how many days we would have starting January 1st, 2022. So Lisa, in closing, I would like to end by saying that nothing is more important than our health and safety, including our mental health, especially now during the pandemic. Employers are a big part of keeping workplaces safe. So thank you for your hard work in this area. Over the past 3+ years of working together, we have made meaningful improvements for people in British Columbia, which means workplaces in British Columbia for both employer and workers to have their input by having their input in. So there's much achieved, more to do, and I look forward to working collaboratively as we did in the past to improve workplace safety. So thank you very much for having me. I really do appreciate coming to your conventions.
Thank you, Minister. As always, it's been our pleasure to hear from you this afternoon. Very much appreciate you taking the time on your very busy schedule to be here with us.
Thank you. And have a wonderful convention rest of the day.
Thank you so much. And thank you all for joining us for this important main stage session today. There is a wealth of continued learning this afternoon that includes our next session. We'll be hosting key takeaways in the leadership track with NGen CEO Jason Myers and Leanne Bartley, Executive Vice President from Dexterra Group. Prevention CEO Scott Coleman is hosting an industry session on wearable technology for workplace injury prevention. And our safety committee track continues with our own Rosa Diaz leading a session on PPE. Lots to come this Friday afternoon. Stay tuned and take care.